how the different counselling approaches compare. We'll explore how different counselling approaches compare and how to think about their differences in a practical and grounded way. Up to this point, we've looked at several distinct approaches to counselling. We've explored cognitive behavioural therapy, also known as CBT, person-centered counselling, psychodynamic counselling, and integrative counselling. Each of these approaches offers a different way of understanding how people change and what matters most within the counselling process. Comparing approaches does not mean deciding which one is best in an absolute sense. Counselling models are not competing products. They are different frameworks for making sense of human experience and supporting change. Understanding their differences help people think more clearly about what they might prefer and why. One useful way to compare approaches is to look at what each one pays most attention to during the sessions. CBT tends to focus on patterns that can be identified and worked with directly. Thoughts, behaviors, and responses are examined closely, often with an emphasis on clarity and structure. If you like understanding things step by step, or you value having a clear framework to work within, this style may feel familiar and practical. Person-centered counselling places its emphasis elsewhere. Rather than focusing on patterns to be examined, it prioritizes the quality of the therapeutic relationship. The belief here is that feeling understood and accepted creates the conditions for change. Some people find this deeply supportive and freeing. Others may wonder how change happens without more explicit direction. Which of those reactions do you notice in yourself when you hear this being described? Psychodynamic counselling approaches comparison from a different angle again. Here, attention is often drawn to patterns that unfold over time, including how earlier experiences continue to influence present relationships and expectations. This approach values depth and meaning. If you're someone who naturally asks where things come from or noticing recurring themes in relationship, this way of working may resonate more strongly. Integrative counselling brings these perspectives together. Rather than asking which approach is correct, which one should I use now, it asks what combination of ideas best fits the person and the context. This flexibility can feel reassuring, particularly for those who do not see themselves reflected in a single model. At the same time, some people prefer the clarity of a clearly defined approach. What feels more containing to you? A clearly named structure or flexible blend that adapts over time? Another way to compare approaches is by looking at how active the therapist tends to be. In some models, the therapist takes a more guiding role, helping structure sessions and direct attention. In others, the therapist follows the client's lead more closely, trusting the process to unfold through the relationship. Neither position is inherently better. They reflect different ideas about how learning and change can occur. Time is another point of comparison. Some approaches are often used in shorter term work, while others are more commonly associated with longer term exploration. This does not mean one is faster or more effective. It means they organize time differently. Some people prefer working within a defined time frame. Others value having space without a fixed endpoint. Which feels more supportive to you when you imagine engaging in counselling? A shorter term or longer term? It can also be helpful to consider how each approach understands insight. In some models, insight is something that emerges through understanding patterns clearly. In others, insight grows out of being in a particular kind of relationship. In psychodynamic work, insight often develops gradually as meaning becomes clearer over time. Integrative approaches may draw on all of these understandings depending on what seems most relevant. Comparing approaches is not about making the right choice on paper. It is about recognizing that different people respond to different ways of working. Two people could attend counseling for similar reasons and find different approaches more helpful, not because one approach is better, but because it fits them differently. This comparison also highlights an important point. Approaches influence how counseling is delivered, but they do not determine everything. The skill, experience, and presence of the therapist matter across all the models. An approach provides a map, not the journey itself. Understanding how counseling approaches compare gives listeners a more informed starting point. It allows people to think about counseling in terms of fit rather than effectiveness alone. It also prepares the ground for making choices later in the series when we explore how to think about selecting an approach or a practitioner. In the next episode, we'll shift focus to professional distinctions by exploring the difference between counselling and psychotherapy and how these terms are used in practice. That's the scope of this episode. Each episode focuses on one specific theme, and this was it. We'll leave it here and move on in the next episode.